And earlier today, I caught up with Central Texas Congressman Lloyd Doggett to get his take on the state and federal response to the coronavirus pandemic. Take a look. Congressman Doggett, thank you for joining us. I first just wanted to ask you about voting remotely. A lot of discussion about whether that should be being done by members of Congress. Where do you stand on the issue of remote voting?
Well, it appeals to me greatly from a personal health standpoint and my desire to be with my family. I think it will be very difficult to do. We're talking about almost $2 trillion of taxpayer money. I think it's difficult to handle this from afar. I know it's still under consideration by the House Rules Committee, but I lean against it.
The stimulus aid package kind of seeing this stall on it right now, and House Speaker Nancy Pelosi unveiling a Democratic version of the bill today. What do you want to see at the end of the day in this and for the American people, for Texans?
Well, the bill that came out of the Republican Senate yesterday from Senator McConnell appears to be the product of fear combined with some of the pressure from some of the most powerful lobby groups in Washington. They're big on taking taxpayer money and very weak on any restraint or strings attached to that money. I want to see the focus be on the people. I voted against the big bank bailout after the financial crisis, not because I didn't think action was necessary, but because I didn't think it all be focused on the bankers and let people lose their homes and their jobs. So my focus would be on health care, as we did in our last bill. I think there's still much to do on sick leave for the many people that could be suffering from coronavirus, on unemployment compensation for those who lost their job going back to the time of the cancellation of South by here in our area, and on our small businesses, because I'm hearing from businesses, again, affected by the shutdown of South by and now by the closure of restaurants and clubs. We need to have our attention there, not on these multinationals who have the strong lobbying force. And so that's my focus, as well as the most vulnerable people in our society who have no insurance, have been left out in a state with the largest number of uninsured people in the country.
I know today is the 10th anniversary of the signing of the Affordable Care Act. You introduced legislation to require a special enrollment period anytime there is a public health emergency declaration such as COVID-19. Can you explain exactly how that would work?
Sure. You know, after Hurricane Harvey, there was a special enrollment period because of all the things that had happened to people there, and after some of the other natural disasters. So back 10 or 12 days ago, I had 100 colleagues join me in asking the Trump administration, even though they don't like the Affordable Care Act, to at least allow people a chance to enroll. We haven't heard anything definitive from the administration. So today, Senator Casey from Pennsylvania, 70 of my colleagues in the House, we all filed legislation to mandate such a period. The analysis that I've seen suggests that there are over 1 million people in Texas who would qualify for a no premium, no cost to them for premiums because of the tax credits under the Affordable Care Act insurance policy. Many others would want to leave the junk plans they may have been tricked into buying and move into a more comprehensive plan. If there was ever a time that people needed affordable access to a family physician, it's right now. I'm pleased that this measure is being included in the package that Speaker Pelosi is putting together. I still have some hope we'll get bipartisan support and a willingness of this administration to put the health of people first and let them protect themselves with health insurance.
I do want to ask you about the testing. Texans and really across the country, testing continues to lag. Governor saying that it is ramping up, as we're continuing to hear again across the country, across the rest of the state, but also calling on the federal government to step up and help out as much as they can. What more is being done? What more can be done?
Not nearly enough. We went through a period of denial, of outright misrepresentation. Everyone remembers President Trump declaring a beautiful test today, yesterday, available to anyone who needs it. I've had calls from this area, from hospitals, from mayors, pointing out the deficiency in the number of tests. And everyone who is pained by being shut into their home with a shutdown order that I think is imminent here, shelter in place, they need look no further than the Trump administration and its failure to have adequate tests as the reason that they're confined. Had we been able to do screening on a large basis, we would have been able to determine more about how this disease spreads and what we can do to prevent it. It is the lack of testing that goes to the heart of why we're having shelter in place announced in one place after another. We just continue to keep the pressure on the administration to get these tests there, to approve additional tests. There are a number of companies now answering the call, trying to make up for the failure of this administration that has done so much harm to so many.
Congressman Doggett, thank you for your time. Stay safe out there.
Thank you so much.